Honorable Prime Minister, ministers, honorable ministers and secretaries, I want to first of all thank you for inviting us young startups over. We would otherwise compete, collaborate, sometimes fight each other in the economic markets of outside Delhi environments, but thanks to you, you made us come together and think together with a common vision and purpose, which is how to deliver a better India in 5 years. And even though it was a one-day event, I think it left us very inspired. I'm here to summarize the findings of the Health and Nutrition Group, whose single mission was how to deliver a Swachh, Swasth and Swaraj Bharat in the next 5 years. And we focused on 5 key areas: medicines, medical devices, nutrition, healthcare delivery, and innovation. So we have a dilemma between us today. We have the top 20% of the country, about 25 crores odd, who belong to the middle class, out of which we have 7 crore who are diabetic, 15 crore who are clinically obese, and nearly 20 crores who are hypertensive. These NCDs trouble the problems of the rich. However, we've got that other bottom half, which unfortunately doesn't have access to enough doctors or medicines. But in this dilemma, we have some hope. We today have more than 300-400 million smartphones. Thanks to your government's efforts, sir, most of them have data, and most of them now know how to transact digitally, thanks to the demonetization that has happened, and thanks to massive consumption of data that has happened. That means it's a ripe opportunity for young entrepreneurs, tech entrepreneurs like us, to solve these massive problems for the nation while bringing a profitable impact at it. So I'm going to begin by medicines. The first and the foremost problem that medicines have in this country is the lack of access, particularly universal, convenient access to medicines. We believe that the best way to solve that is by having medicines on the cloud. We strongly believe in the virtue of having e-pharmacies, of them being able to aggregate inventories and solving supply and logistics for the last mile. And we believe, like everything else on the cloud, it can make the system more efficient, more affordable. There are already some good examples of us doing great work in this area. And the only thing we seek from the government is a clear regulatory framework within that, and more emphasis on manufacturing on our own, in our own nation. We hope that by 2022, 2/3 of all medicines consumed in India should be made in India. Beyond that, sir, we also want to promise the Swaraj in medical devices as well. Today, 70% of the country is unfortunately dependent on the foreign lands for our own medical innovation. But there are entrepreneurs today who are innovating locally. They're willing to invest in clinical trials and tech validations, and whose devices are generating enormous amounts of data. The only thing they lack, sir, is access to patients, access to markets and clinical trials where they can practice their new innovations, as well as a clear regulatory framework. It takes almost 17 clearances and points of clearances with the government before a medical device can be brought into the market, whereas the foreign innovators have already gone through those processes, putting us at disadvantage. So I think a clear regulatory framework there would certainly be helpful. Also creating demand around it. If that data can be used to subsidize insurance premiums, for example, it could go a long way in generating demand for these devices. So nutrition fitness is also equally important in a country that's malnourished for the bottom half and overnourished for this top half who's facing diabetes and hypertension. We have 3 solutions. One is low-cost access to nutritionists and trainers by using apps. Second is app data-based policy interventions. And third is figuring out how do we generate healthy products and healthy foods for the nation. So today, crores of people use health and fitness apps. I'm sure most of you have one in your own phone. The great part is that there are apps today who are also having nutritionists and trainers on the cloud. And people can not only use their apps to, say, track the laddu you just had for your calories, but connect with these nutritionists and trainers and access information from them. This creates 2 things. Employment for stay-at-home mothers who would not get job opportunity otherwise. They could be sitting in Indore and dealing with clients from Delhi, tomorrow maybe in the United States. And secondly, it allows reach of nutritionists into the tier 2, 3, 4 cities, which otherwise would not be possible. So these apps are also generating billions of data points. Several health apps, almost all of us, have billions of data points that we generate every day. This is just one such app, for example, that pointed out that women, particularly in northeast India, simply don't get enough protein as part of their daily intake as men do. So we have a humble request that this app may be used to drive policy decisions and may be integrated within several aspects of government decision making. And we would be more than happy to provide this data to the government. So before Healthify Me, I did an experiment to live on 100 rupees a day and 32 rupees a day myself when the previous government had created that as the poverty line. One of my insights was that the poor simply don't get enough proteins. And unfortunately in PDS, we only subsidize carbohydrates, which is rice, wheat, and sugar. How can we change that? Can we fortify that by low-cost protein alternatives? There was a 1970s US AIDS program created for soy substitution in wheat programs, which didn't work because of taste habits. But today we have new technologies. We have Soylent, we have protein isolates from milk. Can we do something with that to help our bottom half save itself from malnutrition? And what about milk bank for infants? Several children, unfortunately, don't make it beyond the age of 3 because they don't get access to mother's milk at the age where they require them. I think these are important things that must be considered and can be brought together using data from such apps, using PPP interventions between government and private sector, and using and changing subsidy policies based on these data, and by connecting these people to these nutritionists and trainers on the cloud. Not just that, sir. I also had the privilege of working on Aadhaar in its first 2 years of its inception when I had first moved back to India. And Aadhaar today is ever prevalent. Instead of an electronic health record, can we think of Aadhaar-linked health record? Can we think of health records being linked to the India stack so that your own health records become interoperable, so that they become mobile with you, so that you can also track efficacy of medicines and of interventions by the state? So telemedicine also has significant advantages. Not a lot has been accomplished on it, thanks to, unfortunately, due to the regulatory environments that exist and some of the price sensitivity that does exist in the masses. But I think if the same can be proven in that nutritionist trainer map that I just showed to you, we believe that beyond the paramedical sector, even in the core healthcare sector also, indeed it is possible. What is required is strengthening of the PHCs. What is required is better connectivity in the last mile, which is already happening on 3G and 4G, so I guess that bit is getting solved. But it requires some regulatory momentum to make this happen today. And most importantly, sir, we need to integrate health workers training with skill development as well. We all know how overburdened ASHA workers are at the last mile and several others. Can we upskill them so that they can actually enable some elements of critical paramedical measurements which otherwise cannot be done in a telemedicine environment? Affordability is, of course, something that we drive for. RSBY has been a phenomenal measure with great outcomes, but is it possible to add a top-up cover within that? Is it possible to influence and incentivize private insurance to go for higher reaches, just like we did for the mobile telecom, like a USO fund? Can there be insurance, social obligation fund that can be created so that they can go and cover the larger masses beyond the top 8 cities? So there are several other key opportunities that we discussed and deliberated, but I'm going to leave you with just 3. One is what has happened today needs to continue in its momentum, and the several ideas that you heard today need to see itself being implemented. So we call for a National Health Innovation Council or a forum that continues what we have done today beyond today as well. That could have funding by PPP, infrastructure access to resources, but more importantly, access to the government for regulatory facilitation. I've had the pleasure of interacting with many stakeholders in the room, but not every young startup has the kind of ability to be able to reach out to the government and work with them. Second, sir, is that biotech is expected to be a $100 billion segment. We sincerely believe that India is lacking in that component. There are other countries like Singapore that are marching ahead, and we certainly believe that better investment needs to be done here by the nation. And finally is that corporate health responsibility is something we should drive beyond corporate social responsibility. Corporates today are the cesspools of diabetes, hypertension, and obesity. And if there is a way we can make some net profits go towards health and wellness, or perhaps a mandatory health and insurance coverage, it could go a long way. I would like to conclude with where I began, sir. Aadhaar, data increase, and demonetization has resulted in healthcare being ripe for tech innovation and disruption by us as entrepreneurs. And so we are ready to find scale, solutions for scale, both for India, for emerging markets, and even for the first world economies, by harnessing the power of our human capital, artificial intelligence, and technology that India is anyway leading upfront. We want you to continue engaging with us. We thank you for the initiative that you have done today, but we want this to follow up with identified milestones, and we want us to be accountable for that. So together we can build a Swasth, Swaraj, and Swachh Bharat by 2022. Thank you so much.